Greetings. Welcome to another program on ShuraTV. This is our health program. I welcome you. My name is Dr. Zachariah. Hope you've had a wonderful week. Many things are going on with the news, and a lot of health topics are in the news. One issue that we wanted to discuss and get out there is a common autoimmune disease that happens a lot, and it's very prevalent in females. It happens in females more than males, and specifically to colored females, African Americans, Latinos, and Pacific Island Asian women, and it has 3 times more prevalence in non-whites than whites. And this is the disease which is called lupus, or SLE, systemic lupus erythematosus. This is a disease which is autoimmune in the genetics, and we see it manifest in many of these women across different ages. And typically it presents with what's known as a butterfly rash. The butterfly rash is a rash that you'll see developing here and on the cheeks and on the nose, and they get a redness, and you typically these women will typically complain of joint pain. It could be migratory joint pain, meaning that the joint pain travels from one joint to another depending on when it is. So if you have a female and they're usually complaining of joint pain, and they have that rash, and then also sometimes they get aches and pains in other parts of the body, which might get a doctor to diagnose it as fibromyalgia, which is just pain and aches of the muscles. So that's something which might be an undetected lupus case. If you have fibromyalgia, your doctor, your primary care doctor, should have tested you for lupus. The test for lupus is a very straightforward blood test. They do anti-nuclear antibodies, and it's a well-known test. But sometimes some people, it doesn't manifest so quickly. So it's important to keep that in mind. And usually the diagnosis or the incidence of lupus typically occurs in females that are 15 years of age up to 45 or 44. So that's the prime time where the diagnosis is made. So you got to keep that in mind. And then with lupus, you have these what are known as flare-ups, or these times in their bodies where you get a lot of sensitivity and pain. And typically, you get that pain in the joints, you get that aching in the muscles, you get that rash in the face, on the extremities. These people are usually prone to more kidney issues as well. There are specific types of lupus that affect the kidneys, and they alter the water balance of the body. And the doctor has to test your kidney function at least twice a year, if not more, depending on what type of medication you're on. So these are things to look for in lupus. It's very common. We see a lot of autoimmune disease in society now. The cause of it is not known. It's out there. It still has to be determined. There's research being done on it, but the cause has not been, we don't know what the cause is yet. We know that it is autoimmune. We know that it gets triggered by certain environmental factors as well. Stress being one of them as well. If you're stressed, you'll get that flare up. And the question is the flare up being caused by the stress, or is there a genetic predisposition which is already there that the stress is just uncovering it and decreasing your immunity, so then you get the symptoms. So these are the questions that will be determined by researchers. But for us, in terms of signs and symptoms, things that you need to recognize in yourself or in a female that are, there's 10 or 11 main symptoms that we'll go over. And these things are something that you can look for in symptoms of lupus, okay? We discussed joint pain or swelling already, right? And it could be traveling from one joint to another. So sometimes they'll come in, it's a shoulder, it could be a knee, it could be an elbow, it could be wrists, wrist pain. These things all can be attributed to lupus. Also swelling of the hands and the feet, and also they get a little puffiness around the eyes. So you'll notice that puffiness around their eyes. It's an autoimmune condition where your own body, in terms of its recognition of host, which are your own cells, and foreign, which are foreign cells, your body does not recognize. So it attacks its own cells, which cause this inflammation in the body, whether it's around the eyes where you get the puffiness, or in the joints where you get the swelling and you get the pain, or in the feet or in the extremities, the hands, the feet, all these areas. Also, people with lupus exhibit a sensitivity to light. So they're what's known as photosensitive, which means sensitivity to light. So this is something which you have to keep an eye on. If you have a daughter or a sister, a mother, aunt, or a friend who's a female and they exhibit these things, then they need to be tested for lupus. We mentioned the butterfly rash, and then also if they inhale deeply, more often than not, they'll get a pain. They'll get a chest pain, which usually indicates what we know as pleurisy, or the inflammation of the lining of the lungs. So those same infiltrates that are caused by the autoimmune reaction, they're also lining the edges of the lungs. So when these people take a deep breath like that, they'll feel that pain on both sides. So that's something that's telling that this person might have some type of autoimmune response and condition, so they need to get tested. But typically your primary care doctor has this in mind. It's a common condition, so they're always looking to exclude it. And when they do a blood test, you could always ask them to do an anti-nuclear antibody blood test. So they can, all it is a little box they check, and the lab will check for that ANA. ANA, that's what they test for. And that's very important. It's also on the screen over here. And that's something where you can ask for that if you feel that this is something you have. If you have been diagnosed with fibromyalgia, which is just general pain of the muscles, and you've had this chronic pain, it is very important to rule out autoimmune disease like lupus. Treatment with lupus is obviously hydrochloroquine, which is the most common treatment for it, and people on it do well. This drug has been utilized for more than 50 years in medicine. It's safe and effective. There's no known cure for lupus. There's no known cure, so they're still working on finding the root cause of it and something that can tackle that, but there's no known cure. So right now, unfortunately, it's still symptomatic treatment where the goal is to decrease the flare-ups, to decrease the swelling, to decrease the joint pain, to decrease the kidney damage, and to protect yourself. There are certain herbs and certain things that you can do to protect yourself from the joint pain and from the kidney damage and from the lining of the lungs being affected negatively so much. There are things like that we can discuss, but those things are alternative therapies. the mainstay of your primary care doctor will be, usually they'll refer you to someone that does autoimmune disease, which is usually a rheumatologist or an allergy doctor, a layman's term, and they will assess you and see what the cause of your autoimmune disease is. So that's something which usually gets done in the primary care office. They'll assess you and they'll make a determination, and then they'll refer you to your doctor. Some alternative therapies that we can discuss a little bit. Lately, what's known as cell therapy, or what they call stem cell therapy, is something which has shown efficacy for some autoimmune diseases. There's a lot of research being done at different universities and different settings, and there's a lot of clinical trials that you can look up for lupus. And if you're near a major university like UCLA or UCI, California, UCSD, they all have research and clinical trials that are ongoing for lupus. And then the other resource that you can utilize for lupus is the Lupus Foundation of America, which lists all the clinical trials that are going on in the US, and you can register for that, or you can become a patient in that if your symptoms are what they're looking for. They have specific criteria and parameters that you apply for, and if those are the case, then you'll become a subject of that study. Of course, when you're in a study, they have a placebo group, a control group, and then they have the group that they give the new medications to. So depending on which group you get into, you might get new medication and you might not. But at least they'll be monitoring all your symptoms and signs, and you'll know the progression of disease and how advanced it is in your body. A lot of doctors will refer you to a nephrologist, which is a kidney doctor, and they'll usually take a biopsy or an image of your kidneys to see if lupus has infiltrated your kidneys. It's something which will alter your kidney function. So usually they'll check what's known as GFR, which is the glomerular filtration rate. So they usually check that, the GFR, to get an idea of your kidney and how it's functioning. A lot of people don't check the kidneys, and by the time they check it, it's already in stage 3 disease, which is a little bit tougher to deal with than if you were to stage 1 or stage 2. So it's important that if you do have any type of autoimmune issue, that you get your kidneys checked earlier rather than later. Always, we're always about prevention rather than once you get the pathology and then you got to reverse it. It's much difficult to do that. It's easier to prevent from the beginning. So it's important to keep that in mind. And, lupus has that issue where it does have what's known as lupus nephritis, which is the inflammation of the nephron and the tubules due to this disease, autoimmune disease of lupus. So those are things to keep in mind. Also, it affects the heart as well, and you get those same autoimmune infiltrates in the tissue of the heart. So it's important to keep that in mind, and it's important to keep yourself in contact with your primary care office as well as your specialist once you're diagnosed with that autoimmune disease. In general, of course, you have to have a good nutrition and a good serving of vegetables and fruits daily for your body to really have a good chance of reversing or decreasing the effects of lupus on your organs and on your skin. A lot of people get all types of rashes and thickness and things like that in the skin as well. Your skin is the largest organ of your body, so lupus does affect it. So you would notice changes, and you want to keep that in mind and make sure that you're aware and cognizant of that. So those are the things that we wanted to discuss a little bit about lupus. The treatments are there with hydrochloroquine, and usually they take those treatments, and the alternative was you could look into the cell therapy or stem cell therapy. They do it in multiple places here in Southern California as well as in major metropolitan cities across the nation. So these are things you can look at, and in order to decrease, the whole goal is to decrease the inflammation. And anything that decreases inflammation will make your experience with lupus much more easier. A lot of females that are diagnosed with lupus also are advised about pregnancy, because it's tough and it's a high risk pregnancy if you have lupus and you're trying to have a baby. So that is something where you discuss that with your primary care office and your OBGYN. Some OBGYNs are very comfortable and they're able to deal with high risk pregnancies. Some rather not deal with them. So that's something, if you do have lupus and you want to have a baby, it's possible. People do it and they have healthy babies, but it's a little bit more challenging, and there's a little bit more burden and stress on the parents and in the prenatal and postnatal care. So it's a little bit more stressful, but it's doable. There's a lot of people with lupus that do get pregnant and have normal births. So that is possible. That question comes up a lot in forums where people have lupus. So that's something where you can discuss that with your primary care and your OBGYN. And if they're looking to take it on, they can do it. If not, you can get a second opinion from another doctor and see what they think. It's always important to get a second opinion and make sure that you're getting the best care for yourself. Those are basically the signs and symptoms of lupus. It's very common. It's something in females, more in colored females than white females. That's something to keep in mind, and you'll see it. It's not detrimental, but it slowly does affect those organs that we mentioned. It's important to decrease the inflammation and keep yourself on an anti-inflammatory diet. You can Google that up, anti-inflammatory diet, and see what that is. That's something which helps you not only with lupus, but across the board with multiple diseases, because the basis of disease, more and more that we research it, is inflammation. Whether it's heart disease or autoimmune disease or any other types of pathologies, inflammation is the building block of disease. So if you can have an anti-inflammatory diet, we might have a show on that, we can discuss that, then that'll decrease your chances of getting those pathologies. That's very important to keep in mind. I think that's it for lupus. That's all we can say. And if you need resources or information, please don't hesitate to comment and let us know, and we can put you on the right track and get you a referral to a practitioner, to a physician that can help you with this autoimmune condition. Thank you for watching, and we look forward to seeing you again next week. Take care.